Hi, my name is Megan Knockstead, and for this technical writing class, I'm going to be discussing about becoming a registered nurse. Becoming a registered nurse is an awarding field, but it takes a lot to become one. Some of the educational requirements will be reviewed, as well as salary and working conditions. For this presentation, I have a short PowerPoint that you can follow along. First, I'm going to start with becoming a registered nurse. First, I have a quote on the page 2. Nurses are the heart of healthcare. Next, I have a brief overview of what's going to be discussed. First is an introduction, followed by what is a registered nurse. Then, how do I become a registered nurse? How much does a registered nurse make? What kind of working conditions do nurses work in? What is the future outlook for registered nursing, followed by conclusion. First, what is a registered nurse? A registered nurse provides and coordinates patient care, educate patients and the public about various health conditions, and provide advice and emotional support to the patients and their family members. This is very true working as a nurse's aide in a hospital. Next, how do I become a registered nurse? There are different educational requirements that you need to follow. You can either go to a diploma school, such as the Reading Hospital School of Nursing in Reading, PA, which is typically an 18-month to a 2-year program that you can get a diploma certificate, or you can go to a 2-year associate degree program, such as Reading Area Community College, also known as RACC, or you can go to a typical 4-year bachelorette nursing program such as Alvernia University, which I am attending right now. There are also other requirements besides nursing classes for these programs, such as anatomy and physiology, microbiology, chemistry, and other various science classes. Nursing also has clinical that one has to take and pass successfully in order to become a registered nurse. Once one has officially graduated and passed all nursing classes and the required classes needed to become a nurse, they have to take state boards, also known as the NCLEX, in order to become a registered nurse in their state. Once you pass the NCLEX, you're officially a registered nurse and you can practice in which you pass your registered nursing boards at. Next is, how much does a nurse make? This is a big question that a lot of people want to know, and it's good to know how much you're going to make once you graduate and become a nurse. In Pennsylvania, I have a chart, which is the last slide. In Pennsylvania, the median salary for the nurse is about $42,600 a year. Also on the chart, it showed that it's broken down to the United States, Pennsylvania, and Reading, PA, which we're currently at, how much a nurse makes. Nurses can also work in various healthcare settings, such as nursing homes, doctor's offices, home health care, and hospitals. What kind of working conditions do nurses work in? Nurses can work 8 to 12 hours in various types of conditions. In hospitals, they are on their feet for most of the shift, lifting patients, moving things, and carrying things. They are also on their feet for most of the shift, working long, strenuous hours. Typically, nurses work 36 to 40 hours a pay period if they are full-time, depending on the facility. What is the future outlook for nursing? Nursing is a growing field that is growing faster than any other occupation. Growth is primarily because of an aging baby boomer population that will demand more care. Also, the high demand for nurses is just not a focus in acute care settings anymore. It's also focused in other settings, such as nursing homes and doctor's offices, like previously stated. Employment for critical care nurses is predicted to increase by 22% in 2008 to 2018. This is a specialty nursing that nurses can go into that is increasing rapidly. Conclusion. Registered nursing is a highly valid paid profession. There are many paths one can take when entering the field and becoming a registered nurse, such as a 2-year degree program, which is associates, a 4-degree program, which is bachelor's, or a diploma certificate. Many hospitals are seeking nurses who have a 4-year bachelor's degree in nursing. Taking an extra 2 years in obtaining a bachelor's degree can have many benefits and will pay off in the long run. Becoming a registered nurse takes time, dedication, and commitment. There is also many positives about becoming a registered nurse, such as specializing in certain fields like critical care nursing, and also you can further your degree. Learning never ends in nursing, and if one enjoys learning new and exciting information about nursing, then becoming a registered nurse is for you. Thank you for your time, and I hope you enjoy this.